President Obama has talked about healthcare reform bill. You've heard a lot about e-health, electronic medical records. And we're going to talk about that today with a gentleman who's involved in his company OnE, Dino Martis from across the river in Cincinnati. Dino, thanks a lot for coming on.
Thank you, Pat.
Tell us about your company.
Pat, at OnE, our mission is to reduce healthcare costs and improve healthcare outcomes for every American. And we do this by managing health information to eliminate fraud, identify and address waste, and improve the quality of care.
All right, through software?
Through software, hardware, and methods that need to be used to achieve these goals.
I want to get into specifically fraud because it is a huge problem in the federal government and Medicaid industry, Medicare, and the delivery of healthcare. But let's just talk broadly. If there's one area I would think we would need medical records, why don't we have medical records, electronic medical records in this country now?
Pat, there's a number of reasons for that. Electronic medical records have not been used widely for a number of reasons. There is a little bit of pushback from the healthcare providers. As you know, in healthcare, we are lagging behind other industries in the use of information. We need to change that for each individual American. When we talk about fraud, let me make this very clear. We lose 10% of our healthcare dollars to fraud. We spend $2.1 trillion in this country every year, which means we lose $210 billion annually to fraud. That equates to $2,800 for every American.
Unbelievable. Staggering numbers.
Staggering. And the only way we can avoid this is through managing health information. Now, the government has embarked on this task. They are actively involved in Washington, as you know, and they're doing some stuff that is very good and quite hard. But if you will notice, Pat, that they are concentrating on increasing healthcare through increased revenues, through increasing taxes, for example. We've heard of this recently. Taxing benefits, taxing your benefits and my benefits. Well, there are other ways. There are ways where we can recover money that is stolen, money that is wasted. And we don't have to penalize every American by just increasing their burden, their financial burden, or reducing their access to health care. It's a very important issue.
And who would use your software? Would it be the providers, the hospitals?
Absolutely. Everybody involved in healthcare. As you know, Pat, providers account for 80% of the fraud in healthcare. Therefore, we have to concentrate on providers to eliminate this problem and to benefit the Americans.
And how does your system, and I know this is incredibly complicated, Dino, but try to break it down. Basically, how would your system solve that problem or help you solve that problem?
Well, that's a great question, Pat. Today, what we do is the government, insurers, they are involved in trying to solve the fraud problem. But what we do today is we pay and chase. We are reactive. The system is not working. We are recovering less than 1% of the money that is spent on fraudulent endeavors. We need to be proactive. We need to stop this money from going out before it reaches them, not recovery. We're talking about stopping the payment from going out to begin with. Mm-hmm. And how we can do that is through managing healthcare information. And healthcare information is nothing more than what everyone is talking about, which everyone decides we need, which is electronic medical records, or more precisely, electronic health records, which is an integrated health record across all healthcare providers. So, for example, your physician, laboratories, hospitals, nursing, everybody, not just physicians.
And this is something that not only would help in the broader context, not only cut down on fraud and eliminate fraud, but also make it easier for providers to know a patient's history. And if a patient's out of town and gets hurt or has to go to a hospital, a doctor now has to depend basically on a paper record. Is that right?
That is correct.
A transmission of a paper record through a fax or whatever. Now, there are concerns about security, some legitimate concerns, a lot of the demagoguery now. Can that issue be addressed as well? Are you convinced that medical records get online or in the system they'll be secure?
absolutely vet. Medical records done correctly are absolutely secure. Our process involves a lot of security parameters where these records cannot be addressed or accessed rather by anybody except those that the patient, that the individual decides needs access.
And it would just, and I've written about this because NKU is trying to position themselves with their Center for Informatics, which has just broken ground, a $50 million facility that's one of the few in the country. They're trying to position themselves. The federal government's going to spend a lot of money somewhere studying this. The Obama administration, whether this healthcare reform bill passes or not, they've already committed a lot of the stimulus money to this. NKU wants to be the laboratory that will study how to do this on the business end, which is what you're talking about. University of Louisville will look at the medical outcomes under this broad plan being pushed by, among others, Lieutenant Governor Dan Mongiardo. So you have to be encouraged with what you're hearing from the Obama administration on this.
Absolutely. I think the administration is on the right track. They have the right intent. We just have to give them a few more tools to achieve their goals.
And, you know, I know when you said there's some pushback from the providers, I was reading a story last night, an archive story from Computer World, and I've interviewed some of the docs with the Kentucky Medical Association. And they will say that it costs them $15,000 to $50,000 to set this up. But couldn't it save money down the road? And couldn't it also, when you apply this research to wellness, to outcomes, you can start to identify trends much quicker with business as well as on the medical side? It seems to be I don't want to use this cliche, but a no-brainer that we need to be moving toward this.
It's a no-brainer, Ben, and you're absolutely right. We can save money, and providers. Today, this is what is happening in healthcare. When fraud and waste take place, the only way to allow for continuing healthcare is by reducing fees to providers. Physicians are getting their fees cut. Other providers are getting their fees cut. This will alleviate that problem by encouraging the use of electronic records. We will reduce administrative burden. We will increase the quality of healthcare, and therefore providers will ultimately make more money.
Cutting edge stuff. And I'm going to have you on the record show this fall. We're going to get into a lot more. I'm fascinated by this topic, and I really look forward to jumping into it with you. Dino, nice to meet you. Good luck with Ani, and be looking for Dino to come back on the fall on the record show.
Thank you very much.
You're welcome. We'll be right back on Northern Kentucky Magazine.